Hi there, this is Nick Casimia, and I'm here at Project Inform in San Francisco with Head of Education, Alan McCord.
Hi.
How are you?
Good, very good.
So let's talk a little bit about Project Inform. What is your mandate? Because you're a San Francisco-based group, correct?
Yes. Well, we've always been an advocate, a strong advocate for patient education and patient empowerment. And when we got started in 1985, that's really what we were focusing our work basing it on, working with the federal governments plus researchers and academia to really include and consider the needs and around treatment for people living with HIV. So a lot of our work has really just been, stemmed from that. We have patient education programs, we have advocacy program, as well as we follow through on the implementation of the ACA now, not only on the California state level, but at the federal level. And just a couple years ago, we included hepatitis C education as well, because a good significant number of people with HIV also are co-infected with hep C. So,
in regards to HIV specifically, do we have any idea in regards to stats of infections? Are they depleting? Are they increasing? What is the ideology behind it? What are some statistics about HIV?
Well, with HIV at the national level and in the United States, it's been holding steady at about 50,000 new infections every year. So that's a troubling, it's a good thing that it's not going up, but it's not, it's a troubling statistic because it's not going down. Prevention efforts are not making the same kind of impact that we saw in the first part of the epidemic. And beyond the 50,000 new infections every year, the demographic of the epidemic has changed as well. So you see higher rates of infection among Black and Latino, young Black and Latino men who have sex with men, as well as in women of color communities. We still see a proportion, the highest proportion in gay men communities, but in those people of color communities, it's certainly higher and needs to be addressed and dealt with in a constructive way.
Let's talk about PrEP, if you don't mind.
Sure.
First of all, let's define, what is PrEP?
So PrEP stands for pre-exposure prophylaxis, and what that is taking a pill in order to prevent the, infection with a virus or bacteria before you are exposed to it. So in this case with HIV, an HIV negative person would be taking what's called Truvada, which is a daily pill, in order to prevent HIV if someone has been exposed to the virus.
Now Truvada was, or PrEP as it is known, has been tested in San Francisco for the past few years through various studies. How successful has it been through these studies? What is your take from it as someone who works at Project Inform and spearheads educational?
In 2012, the FDA approved daily Truvada for PrEP in men and women, and that recommendation or approval was based upon two different studies. One, Partners PrEP, which is using PrEP in heterosexual men and women, and also data from the PrEP study, which was in men who have sex with men as well as trans women who have sex with men. So Partners PrEP was the first study. The second one is called PrEP.
What did we glean from that? How effective are they?
They're highly effective. Now, if you look at the overall statistics with Partners PrEP, I believe the overall efficacy was 63%. In PrEP, it was 44%. So 44% reduction in of HIV infection with those HIV negative individuals who are taking daily PrEP. Now, those numbers may not sound terribly promising, but when you look at those individuals, now those numbers actually include everybody that are in these studies, not only the people that are taking PrEP, but the people who are not taking PrEP.
So the people on placebos, for example?
Yes,
okay.
Those are also included in those numbers.
Okay.
So if you go and look at the numbers of those individuals that are taking PrEP, then the rate of risk reduction is increased each time. So 2,499 people were in the PrEP study.
Okay.
So half of them were on placebo, and
right.
the other half were taking Truvada. If you look at those individuals that were taking Truvada, who were reporting that they were taking it at least 50% of the time,
So like 3-4 times a week.
Yeah, and that's through pill count, bottle count, and someone reporting that they're taking that at least 50% of the time.
So, okay, so of the study of almost 2,500 people, half were on placebo, half were not.
Yes.
They were on this test drug, Truvada.
Yes.
And of those who were on Truvada, they were how many if they were taking it daily, how effective was it?
If they were taking it daily, so the study researchers actually looked at not only were they asking for the participants to report how often they took it, but they also took blood samples in order to see if, comparing what they were saying they took it to actual presence of drug in the blood. So if you looked at those individuals who had drug present in their blood, then the reduction of risk it goes up to actually 90%. So the theme here, and what we've seen in many of the other PrEP studies, is that adherence is really, really important. The more frequently you take it, and especially if you're taking it daily, you have a high risk, a lower risk of HIV infection.
This to me, this sounds like a breakthrough.
Definitely. Yes.
Definitely.
Yes.
You say this without any hesitation, because some people have hesitated saying that.
No.
Like, do you know why some foundations, some individuals are a bit weary and wary of PrEP?
I think it's a variety of reasons. One, I think a community shame plays a role. I think moralizing around not using condoms plays a role. The reluctance of providers not taking up this as part of their routine care for their patients, because it's more of a preventive thing than a reactive medical intervention. And then also there's this concept of slow ideas versus fast ideas. There's a surgeon by the name of Atul Gawande who wrote a book about slow ideas in the medical field. And he compared the uptake of anesthesia to the uptake of antibiotics. And that anesthesia was a very fast moving idea because there was immediate results. You give somebody a painkiller, then they can certainly go under the knife for surgery very well. But if you don't see bacteria, then antibiotics is sort of a slower idea to get moving. Now, it's mainstream now, using antibiotics, but in a way, I believe that PrEP is probably this slow idea. It's a great idea, and it's really good for the right individuals. It's certainly not something for everyone to use, but unfortunately, people just haven't grabbed onto it in the way that I think really it's a game changer in the prevention field.
So how do you think it's a game changer?
The first part is that it's a medical intervention. So we haven't seen medical interventions around prevention as far as sexual activity is concerned. We really have been pushing condom use and reduction of number of sex partners and those sorts of harm reduction techniques. In this way, now we're introducing a compound into the equation, and you have to get involved with your healthcare provider around that. Have honest discussions about your sexual history, about your sexual health, which often in the American healthcare system, you find way too many providers who are reluctant to talk about healthcare, your sexual health. So I think in some ways it's a game changer because it's going to force the American healthcare system to deal with this sort of aspect around sexual health. And the other, there are a number of people who just have found it difficult to use condoms consistently. And what do we do with those individuals? Do we continue to hit them with that message of consistent condom use, or is this new option something that will help those individuals in high risk situations reduce their risk a great deal, thereby cutting down that 50,000 new infections every year in the U.S.?
Do we know, obviously you're in the education field in regards to HIV research, and you call this data. Do we know how often people actually use condoms effectively? Do you have any idea?
That's a good question. I actually don't know enough about that. I do know that condom sales are down over the last 5 years, so it doesn't appear that condoms are being used as often. I think there's the seropositioning and serosorting that happens. So positives, seeking out other positives to have sex with, negatives seeking other negatives to have sex with, has been, one way to reduce risk, as well as seropositioning. So if you're topping, you're at a less risk than what you are in bottoming. People have been reducing their risk in a variety of ways over the years. One is serosorting, another is seropositioning. And in those cases, condoms may not be used because it's another technique, another strategy in reducing one person's risk for acquiring HIV. So as condoms have not been used nearly as much as what it once was, certainly in the 80s and 90s, people are still at risk. So the placement of PrEP in this mix is one way to help solve some of the exposures that are occurring. And there are other opportunities for using PrEP. So in serodiscordant couples, so there's plenty of people who are negative, positive, mixed status couples. I'm sure many of them have safer sex practices, but wonder if the condom does slip, wonder if the condom isn't around. So using PrEP in that situation can help with that, as well as with family planning measures. So for heterosexual couples who want a child, who want to go through having unprotected sex in order to get there, PrEP can protect the HIV negative person. So at least in those two situations, it's really clear where PrEP can be a significant improvement over reducing someone's risk.
So if you're a heterosexual couple and one of you is HIV positive, is that what you're saying? Mm-hmm. Just so I'm clear.
Sure.
And the woman is obviously just wants to conceive. Does PrEP prevent then the fetus also from getting HIV?
Yeah, the only way that a fetus gets HIV is from the mother. So if the man is HIV positive, the baby's not going to get directly HIV from the father.
That's great.
Yeah.
Isn't it?
Yes.
I mean, we see, not just in North America, we see this with other countries specifically, in Africa and whatnot, of these women getting, the HIV virus. This is amazing. But is the cost the issue then for a lot of these organizations? Is some of the criticism of PrEP, is it all based on the fact that its market price is more than $13,000 a year in America, at least? Is that the contention?
I don't notice that as like the number one or even the top 3 or 5 issues.
Really?
I think it goes back to what I was mentioned earlier. I think it's the shame and the moralizing that happens around this. Condoms are really cheap, and if you use them properly, they're very effective. And I think a lot of folks, because there's been so many decades of condom use, that we think that's just the simple answer to everything. Unfortunately, condoms aren't used all the time for a variety of reasons. It may be, personal preference, but it may be that there's some control issues within the relationships that you have with others. In that case, some people don't feel like they can, ensure that a condom is being used every time during sex. So PrEP in this situation would be, an advantage to preventing HIV. So I think that there's that moralizing, judgmental attitude that's there not only in the community, but also I think in the medical provider community as well. So, and then the lack of awareness around PrEP. We've had conversations with AIDS service organizations around the country. We're trying to put together a resource guide, and we're coming into contact with a wide variety of attitudes and opinions about PrEP. Ranging from ASOs who don't even know about PrEP, which is really surprising to me, to really strong advocates that are really trying to do things on the local level, and then also to the other extreme, to hostility around the fact that no, we shouldn't be doing this, or because we need to take care of HIV positive people first, that should be where we place the funding, and so that prescribing PrEP for individuals is sometimes looked at as taking resources away from the HIV community.
Does that make sense to you?
Yeah, I think it's a rightful, discussion point that, how do we use limited funds that we have in America, especially with the ACA becoming implemented, and how things are going to shake out over the next several years. Where are you going to get your HIV care? we should make sure that those people with HIV have continued coverage and continued access to their HIV meds and docs. But likewise, why add to the burden of America's burden around HIV if we should be trying to prevent as many infections as possible. And so if we can cut that 50,000 new infections each year down, by 10, 20, 30,000 through the use of PrEP, then I think that's a very successful way of using this intervention.
Is PrEP the new condom?
I don't think I would say yes. It's not the new condom. I think it's another prevention method. We have, there's so many strategies out there, getting to know your partner, getting to know your partner's history, understanding your own behavior around sex when there's drug use or alcohol use. Do you top? Do you bottom? How about serosorting, seropositioning? Are you reducing your drug intake or your alcohol intake? There's lots of ways to reduce risk along the way. Condoms is certainly another way to do that, and PrEP is yet another way to do that. PrEP is not for everyone, just as some of those other strategies are not for everyone. So whether PrEP is the new condom, I'm not so sure about that. I think condoms work for a certain number of people, and that's great, and let's consistently use it and promote it. But like the pill, when it was developed in order to prevent pregnancy, this is similar to that. It changes the prevention toolkit, so to speak, a bit. It's not for everyone, but it's certainly there for those people who would benefit by using it.
And as an organization that is all about educating and informing, you're called Project Inform for a reason. What is is it frustrating because people are murky about PrEP because it is a tool?
There's lack of awareness certainly out there, and we want to let people know that PrEP is available. Whether they use it or not, that's up to them. But we want to be able to provide the accurate, up-to-date information around PrEP. So awareness is one. Education is one of our main goals, is to make sure that folks know and understand their rights and the availability of the intervention. And lastly, we really do see a great need to educate the medical community around this and really challenge some of the attitudes and judgments that we're seeing out there. It seems like insurance companies will provide for PrEP, whether there's some prior authorizations that happen because of that. I think there's going to be some difficulty with some people accessing PrEP through their healthcare provider. But I think it's the healthcare provider field that we really do need to do an awful lot more outreach to and get them up to speed with this pill.
Is morality a factor here? Is it the fact that gay marriage now is becoming legal in the United States? Is it the fact that, gay men specifically, and I know HIV is not just for gay men, but it's still predominantly thought of as a gay man's disease. Is it like gay men are being accepted in society as, monogamous, happy-going, and this pill, this magical pill, can mean like men can go out and screw around again? It brings back the whole hedonistic lifestyle back. Is it a moral crusade also?
Yeah, that could be sort of the genesis of some of the moralizing and the shaming that is there, that we should protect ourselves as long as possible by using condoms until AIDS is gone. And where we go with that, I don't have the answers to it, but I think we need to work through that. What we know is that this data is here, and it's here for a reason, and we shouldn't ignore it. It's not a foolproof prevention method, obviously, because it's not 100%. None of these international studies have shown 100% reduction of HIV.
But it's pretty high.
But it's pretty high.
Yeah.
And as I said before, adherence is a key issue. So if you're able to take this drug on a daily basis, for now it's daily Truvada for PrEP. Hopefully within the next few years we see maybe intermittent PrEP might work, or vaginal or rectal gels, microbicides may also work. and long-acting injectables. So the drug gets injected once a month, and perhaps you can move on with very little worry afterwards. I think we should use science and medical field in order to address some of these issues, these lasting things that are there, like the 2 or 3 million infections that happen every year.
What about this whole idea of why give someone who's perfectly healthy a pill to change their immune system? To what effect? We don't know yet. The studies for PrEP are still really new. We don't know what the long-term effect of PrEP would be, and immunity would happen. What is your take on that?
Well, with Truvada, it is the most prescribed pill, HIV pill, among HIV-positive people. So we do know, a decade more and more information around the safety and effectiveness of that pill. So those 2 drugs that are in that one pill. So we know the effects of how that affects the body. To some degree, there's some concern around kidney function. So if you have poor kidney function, you probably shouldn't go on PrEP or really make an informed decision with your provider before you start. So we know what to look for, we know what to gauge along the way, and as people, since they're on PrEP, need to go in to see their doctor once every 3 months, there's regular blood work and that sort of thing to make sure that the body is healthy along with taking this drug. So we know that it's a fairly safe drug. And it's not something that people are probably going to be using for the rest of their lives. I've talked to many men who, at one point in their lives, for 3 or 6 or 9 months, that they've had high-risk sex and they needed something else to protect them. But once they met somebody, and I've had a couple of conversations where they meet somebody, they've fallen in love, it becomes a monogamous relationship, PrEP is no longer an issue. So it's probably a temporary thing for most individuals. It may not be a temporary thing for those mixed status couples, but in those couples, maybe that extra pill once a day is worth perhaps some of the unknown things that you're thinking about that may happen 10 or 15 or 20 years down along the way.
Do you have a lot of one-on-one contact with people about sex? Because are you kind of I know you're an educator, but what does that mean exactly?
Well, on our website, we've developed some educational videos around PrEP, and so we've promoted that. We also have a PrEP resource page on our website, projectinform.org/PrEP. So people have access to those resources that we're recommending. We also have a link to email us if you have any questions. We've been involved with PrEP advocacy for the last 5 years, and even up to one of our staff people being at the FDA hearings to give testimony and to report back on that. So we're very interested in implementation at this point. We know plenty of researchers. We are in touch with healthcare providers, and we want to know from the patient level what their experiences are like. We want to be able to get individuals to access PrEP when they want to, because they've made that decision that they find that's an appropriate decision for themselves. But sometimes there are barriers in that process. So we want to be able to help as many people as possible individually, but then that also informs our advocacy work, in different aspects.
Great. Thank you.
Okay.
Thank you.
Well, thank you.